How many people regret their first choice of Medicare plan? Would you guess 50%? And more importantly, is the plan that you're about to pick one of the ones that people fight to get out of later? The number is more than 50% when you combine people who choose a Medicare supplement plan and switch to a Medicare Advantage plan with the percent of people who switch Advantage plans or switch to a supplement from an Advantage plan. Sounds confusing, but a startling 50% of the people who pick a Medicare Advantage plan as their first plan in 2026 will switch to a different plan or back to original Medicare within their first 5 years. And this is according to data that's been published by KFF.org, MedPAC, and the Health Services Research that's published on PubMed. 3 separate studies, and they're all using, of course, Medicare's data. Now, some switch because their doctor left the network, and some switch because they got hit with a medical bill that they never saw coming, and some, perhaps the lucky ones, switch before anything happens. Now, on the other side of the fence, 3% of the people with a Medicare supplement plan switch to a Medicare Advantage plan each year, and that adds up to 15% over the first 5 years. And this is almost always due to rising premiums beyond what their budget can tolerate. And those two together, according to the data by KFF.org and others, it's a whopping 65% of the people new to Medicare regret their first choice of Medicare plan. My goal with this video is to help you be one of the 35% of the population that does not regret their first choice of Medicare plan. So today, I'm breaking down who ends up in each Medicare plan, why they choose it, and what they like about it, and what they will regret about it. So I want to be clear about something, too, in those statistics. These aren't people who made stupid decisions. I believe many made decisions based on incomplete or incorrect information, and that's the only difference between them and you. So stay to the end because I'm going to touch on what Medicare will look like 5 years from now as well. A glimpse into the future of Medicare will help you choose the right plan today. Welcome. I'm Matthew Clausen with MedigapSeminars.org, and this channel is built around one goal, making sure you understand your Medicare options before you make a decision that you cannot easily undo. So today's video is different from most of what you're going to find out there. We're not going to simply define your Medicare options. We're going to talk about who chooses each option, the actual demographics, the income levels, the motivations, and then we're going to talk about what each group likes about their choice and what they regret 5 years later. And then at the end, as I mentioned, we're going to cover where Medicare is headed in what the future will look like in the years ahead. And we do that because the decision that you make today has to account for how your health and your health insurance will change in the years ahead. When you enroll in Medicare Part B, and I'm going to explain what that means here in just a moment, but you're immediately standing at a fork in the road. And there are 3 paths in front of you. Path 1, you keep original Medicare, Parts A and Part B, and perhaps add a standalone Part D prescription drug plan, and do nothing else. Path 2, you replace original Medicare with a Medicare Advantage plan. And then Path 3, you keep original Medicare and you add a Medicare supplement plan, also called a Medigap plan. Now, every Medicare beneficiary lands on one of these 3 paths. And as I walk you through each one, pay close attention to the demographics because the who is just as important as the what. Now, I know what you're thinking. Let's just skip to the end and tell me which one to pick, and I will get there. But here's what I know from working with seniors for 3 decades. The people who regret their decisions almost always skip that part. So first, let me give you a brief foundation. Now, I know this part sounds like a school lesson, but stick with me because what I'm about to show you regarding Part A is exactly where the potential unlimited financial risk trap is hidden. Original Medicare is the foundation that every Medicare option is built on. Original Medicare is a combination of Part A and Part B together. So what is Medicare Part A and Medicare Part B? Well, Medicare Part A is your inpatient coverage. When you're an inpatient in a hospital, a skilled nursing facility, inpatient rehab, inpatient surgical procedures, a hospice, your Medicare Part A is activated. In 2026, Medicare Part A has a deductible of $1,736 per benefit period. And this is important. I don't want you to miss this, because next part is where most seniors get blindsided. The Medicare Part A deductible is not an annual deductible. It's not paid just once per calendar year like most of the insurance deductibles you've had in the past. It is a per benefit period. A benefit period begins the day you're admitted to the hospital and ends when you've been out or you've been discharged from the medical facility for 60 consecutive days. If you come back home from a hospital and then 75 days later you're back in the hospital again as an inpatient, that's a new benefit period and another $1,736 deductible. Theoretically, obviously, you could pay that deductible multiple times in a single calendar year. Now, after that deductible, you'll have copays that start after you've been an inpatient for 60 consecutive days. And then the Part A coverage stops paying anything after 150 days as an inpatient in a single benefit period. Now, if you're a hospital inpatient for more than 150 days, you've exhausted your Medicare coverage, you're paying all expenses out of pocket. Now, Medicare Part B is your outpatient and physician services coverage. Medicare Part B covers your doctor visits, your lab work, your outpatient surgeries, durable medical equipment. What is durable medical equipment? Durable medical equipment is your wheelchairs, your oxygen equipment, your insulin pump. It can be equipment that can run into the thousands of dollars, and Medicare Part B benefits cover that. Plus, of course, Part B includes physical therapy and chemotherapy as an outpatient. Part B also covers outpatient medications that are administered by a medical professional. Basically, if your care is not covered under Medicare Part A, it will likely be covered under Medicare Part B. In 2026, Part B has a $283 annual deductible. It's paid just once per year. Your Part B monthly premium for most enrollees is $202.90 per month. Again, this is 2026 numbers. Though higher income beneficiaries pay more through something called IRMAA, Income-Related Monthly Adjustment Amount. And some of you watching this are going to pay significantly more than $202.90 because of that government surcharge, again, the Income-Related Monthly Adjustment Amount. And I've seen people completely blindsided by IRMAA surcharges that increase both your Part B and your Part D premiums. If your household income is above certain thresholds, you need to know about this before you retire. And I'll have an updated video on IRMAA surcharges very soon, so subscribe now if you don't miss out. So all of those numbers, the deductibles, the premiums, the coinsurance, and the IRMAA table change annually. And that is why I publish on our website the Medicare Part A and Part B costs, including IRMAA, each year. And you can download it for free from our resources tab, or it's probably linked in the show notes below and here on my left shoulder. And here's what Original Medicare does extraordinarily well. It gives you access to any doctor, any specialist, any hospital in the entire United States and its territories as long as they accept Medicare. There's no network, there's no referrals, there's no insurance company sitting between you and your physician deciding whether your treatment is medically necessary. Your healthcare decisions are between you and your doctor. And here's the part that they don't put in the Medicare welcome letter. What Original Medicare does not do. There's no maximum out-of-pocket limit. None. Zero. If you develop cancer, have a catastrophic accident, require extended hospitalization, your financial exposure is theoretically unlimited. Part A covers the first 60 days of a hospital day in full after the deductible, but days 61 through 90 you pay coinsurance amount per day, and beyond that, even more. Medicare Part B only covers 80% of most outpatient and physician services. You pay 20%, and that can add up quickly during a serious illness. And that's the Achilles heel of Original Medicare as standalone coverage. And it is exactly why most people add something to it, either an Advantage plan or switching to an Advantage plan or a supplement, both of which can limit your financial risk. Who actually keeps Original Medicare without adding anything to it. And why? Well, the answer might surprise you, because this group is not who most people think of. They consist of about 10% of Medicare beneficiaries. The 10% keep original Medicare with just a standalone drug plan and nothing else. No Advantage plan, no supplement, just bare Medicare. And who are these people? Most of this group consists of people under the age of 65 who've qualified for Medicare through a disability. They may be low income, but they earn too much to qualify for Medicaid, which would otherwise fill most of Medicare's gaps for free. They're caught in the middle. They're not poor enough for financial assistance and not financially stable enough to afford a Medicare supplement or supplement premium. When you're managing a disability, your priority is often accessibility. You have to access the specific doctors and specialists that you need, and not necessarily which plan costs less. Many of these people live in rural areas where Medicare Advantage networks are so thin they literally cannot join an Advantage plan and keep their current doctors. So they stay on original Medicare by necessity. However, there's no federal mandate requiring insurance companies to offer a Medicare supplement to people under the age of 65. That means that unless there's a state law requiring the insurance company to offer them a Medicare supplement at a fair price, a Medicare supplement plan is simply not an option. They choose the freedom of original Medicare. They want to see the doctor they need, not whomever a private insurance company puts in their network. And these are benefits that they would have with a Medigap plan too, but they're none available to them until they reach the age of 65. So what do they like about their original Medicare? Zero bureaucracy, no gatekeepers, no prior authorizations. Their physician makes the medical call, not an insurance company. What do they regret? The bills. When something goes wrong, and statistically something will, there's no maximum out of pocket to stop the financial bleeding. 30% of this group has reported delaying or completely turning down medical care they needed because of the cost. That's no small percentage, 30%. 3 out of 10 people in this group skipped care that they needed because they couldn't afford the cost that original Medicare leaves as their responsibility. And that's the reality of going bare on Medicare. It's a freedom plan, and freedom without protection has consequences. So now let's talk about the plan that has exploded over the last decade, Medicare Advantage, also known as Part C. Medicare Advantage now covers more than half of all Medicare beneficiaries in the United States, and it is, without question, the most heavily marketed option in all of Medicare. More than half of all Medicare beneficiaries are now on a Medicare Advantage plan. Half, and 50% of them will switch plans within the first 5 years. Do you think the people selling these plans led with that number? I don't think they did, so I will. Now, when I say switch plans, I mean they will either switch to a Medicare supplement or to a different Medicare Advantage plan that better meets their needs. Their first Medicare plan was simply not suitable for what they needed. And here is what most people don't consider. There are actually 2 completely different demographic groups who end up on the Advantage plans, and they make their choice for entirely different reasons and have different regrets. So let's start with group number 1. That's the individual Medicare Advantage plan enrollee. The number 1 driver of individual Advantage plan enrollment is personal budget, not benefits. Research confirms the numbers. There's 73% of individual Medicare Advantage enrollees say they could not afford more than $50 per month in premiums. More than half couldn't afford any monthly premium at all. Their income is entirely or almost entirely their Social Security. Many Medicare Advantage plans have a $0 monthly premium, beyond the monthly Part B premium that everybody's required to pay. For someone on a fixed Social Security income, that is genuinely powerful. They have a plan that limits their maximum out-of-pocket risk with no extra cost. Now, I'll bet many of you are assuming that Medicare supplement plans have a higher income demographic, but that's not the case. The demographic that defines Medicare supplement plans is not based on income at all. But I'll get to that in a moment when I finish on Advantage plans. So here's what shocks most people. Medicare Advantage plans replace your original Medicare. They are an alternative to original Medicare operated by a for-profit insurance company. In exchange for that zero or low premium, you receive a maximum out-of-pocket cap, and in 2026, that cap is $9,250 for in-network services. That is better than no cap at all. They also have extra benefits that may include a gym membership or limited dental or over-the-counter drug allowances, limited vision coverage. Some small HMO Advantage plans will even reimburse part of your Medicare Part B premium, but there's no free lunch, so you have to be careful with that. But in exchange for those benefits, you're restricted to a network of doctors and facilities that are contracted with your specific Advantage plan. Doctors must receive prior authorization from the insurance company before providing non-urgent treatments, meaning the company can delay or can deny care that your doctor recommends. Plus, benefits and costs change annually. What's covered this year may not be covered next year or covered but at a different cost. And networks can change annually or literally at any time. And let me address a myth I see agents repeat constantly, one that is demonstrably false and causes real harm. And this is important. Many insurance agents will tell you that with a Medicare Advantage PPO, you can see any doctor who takes Medicare. This is not true. It's more accurate to say that you can ask any doctor that takes original Medicare to accept your Medicare Advantage PPO. But the doctor is under no obligation to accept your insurance and will typically decline your request. Most people who choose a Medicare Advantage plan do so because it's a low-cost way to set a maximum out-of-pocket limit on financial risk and can include extra limited benefits like dentals, cleaning, and gym membership. What is it that this group regrets the most? First, the surprise medical bills. They pay a 20% copay on cancer treatment right up to the $9,250 annual maximum out-of-pocket, or whatever the maximum out-of-pocket is on their plan. They may have had a doctor recommendation that was denied by the insurance company, or a doctor who just stopped accepting their plan mid-year and left the network. Or it's the benefits that quietly change and every year without anyone calling to warn them. Now, as I noted earlier, 50% of the individual Medicare Advantage enrollees switch Advantage plans or return to original Medicare within their first 5 years. Half within 5 years. That number alone tells you everything about the gap between what these plans promise versus their reality. But wait, as I mentioned earlier, there is a second group of Advantage plan enrollees. Most or many in this group don't even know they're on a Medicare Advantage plan. And that's a scary truth. And when they retire, they end up finding out the hard way. This group troubles me the most, not because they made a bad decision, because most of them never got the chance to make an informed decision. They were not fully informed of the pros and cons of their choice. And I'll tell you why that is in a moment. These are mostly people who work past the age of 65. Their employer offers group health coverage for people aged 65 and older that happens to be structured as a Medicare Advantage plan. It looks like the work insurance that they had for the last 20 years. Same structure, same HR enrollment process. But they're required to also enroll in Medicare Part A and Part B. Now, many of them don't realize what they've actually signed up for until they retire. No one said, this is a group Medicare Advantage plan. They thought it was just their employer health insurance. They chose the plan out of comfort. No research, no comparisons, no due diligence. It was just there and it felt familiar. But they were also not fully informed because they didn't know their company was financially compensated for getting them into a Medicare Advantage plan. It's always about money. So here's where it gets serious. Once they enroll in a Medicare Part B, they have a 180-day window where they can get any Medicare supplement plan with no health questions asked. Your first 180 days on Medicare Part B is your Medicare supplement initial enrollment period. So they signed up for Medicare Part B to get their employer advantage plan, not knowing it triggered their Medicare supplement initial enrollment period. Once they retire, they find out that they must qualify medically for a Medicare supplement. But they can't qualify. They had a heart condition or chronic disease or recent cancer. The window that they didn't know they had closed while they were still working. So what do these people like about their choice? The familiarity. It felt like their old work plan, often employer subsidized. What do they regret about their choice? Discovering sometimes years too late that they are now locked into a network, they're subject to prior authorizations, and they're unable to qualify for a Medigap plan because their health changed while they were focused on their career. No one told them of the consequences of their decision. Heck, no one even told them their employer was compensated for steering them into this choice. And group Medicare Advantage plan agents are not regulated as strictly as those of us who offer individual plans. So this is one of the most preventable Medicare mistakes I see, and it happens to good, intelligent people every single day. Now let's talk about the group that, by virtually every satisfaction metric available, has fewer regrets. Original Medicare plus a Medicare supplement plan, also called the Medigap plan. So who chooses this path? Well, here's what's I find genuinely fascinating on the statistics. Medicare supplement buyers come from all income levels and all walks of life. The demographic is not defined by wealth. It's not defined by an education. It's defined by something else entirely. It's defined by due diligence and personal research. Medigap buyers are the people who compare their options, people who read, people who ask questions, people who watch videos, and don't trust the first agent who calls or the commercial that runs during the evening or their neighbor's advice in some cases. They make deliberate, informed decisions, and that decision statistically leads to significantly fewer regrets than either of the other two paths. So what does a Medicare supplement actually do? A Medicare supplement plan works alongside, or say hand in glove, with Original Medicare. You keep Original Medicare as your primary insurance, and all of Medicare's benefits, all of its freedom to see any doctor anywhere in the country. Your doctor doesn't have to ask permission from an insurance company before they treat you. The supplement policy simply fills in the financial gaps, the deductibles, the co-pays, the co-insurance that Medicare leaves as your responsibility. The benefits are federally standardized. Plan G from Company A has the exact same benefits as Plan G from Company Z. The only differences are the monthly premium and the insurance company's reputation for stable pricing. You're shopping purely on price and reputation, not on coverage. And once you have a Medigap plan, it is guaranteed renewable. The insurance company cannot cancel your plan as long as you pay your premium. They cannot change or reduce your benefits. They cannot remove you or charge you more because you got sick or filed too many claims. And that's what guaranteed renewable means. Now, according to the industry surveys, 85% of all Medigap enrollees choose one of three plans. And I'll walk you through each one here in just 60 seconds because the differences matter. Plan G, which is the most popular Medigap plan by a wide margin, 66% of Medigap enrollees choose Plan G in 2026. Plan G covers everything Original Medicare covers. It pays all the co-pays, deductibles, co-insurance that you would normally pay with just Original Medicare. And with one exception, is that you will pay the Medicare Part B annual deductible, which is currently $283. You pay that deductible once at the start of the year when you first see a doctor or first get a medical service. And for the rest of the year, your out-of-pocket on any Medicare-approved service is essentially zero. No co-pays, no surprise bills. Your doctor in your hometown sees you, a specialist in another city sees you, you travel and get sick, you have care, and Plan G picks up the rest. No network check required. Now, Medicare Supplement Plan N is the second most popular. It's chosen by almost 11% of the Medigap enrollees, typically the more cost-conscious buyer who is comfortable with small copays. It's up to $20 for a doctor's visit or up to $50 for an emergency room visit. And in exchange for that, they have a lower premium than Plan G. And then the next, and last but not least, is the High-Deductible Plan G. It's Plan G HD, and that attracts about 3 to 4% of the buyers, and it's growing in popularity. People who want the lowest possible monthly premium and are financially comfortable with absorbing the Medicare set deductible before the supplement kicks in, not before Medicare kicks in, before the supplement kicks in, will often choose that plan. So why do people choose a Medicare supplement plan? It's almost never primarily about cost savings. It's about keeping control of your health care as you age. No network restrictions, no prior authorizations, no insurance company between you and your physician making coverage decisions. Your health care decisions are between you and your doctor. And critically, your benefits will not change. What you enroll in today is what you have at age 75, at 85, at 95, when you need it the most. So what do people like about this choice? Predictability, peace of mind, the ability to go to any doctor anywhere without calling to check if they're in network. No surprise bills, no annual benefit changes. What do they regret the most? Complaints about health care or health insurance coverage are almost non-existent. The primary frustration for Medigap enrollees are premium increases, the rising monthly costs, and they're justified in that frustration. The Medigap premiums do increase over time. Since 2021, Medicare supplement prices have been unusually high compared to the previous decade, and that trend will continue for the foreseeable future. Medicare supplement owners should expect their Medicare supplement premiums to increase by at least 300 to 400% over the next 20 years. If you purchase a plan that you can barely afford today, there will likely be a time when you simply can't afford it. And this is why the Plan G high deductible is becoming more popular. If you preserve all the benefits of original Medicare, you have a lower maximum out-of-pocket risk than an Advantage plan, and the premiums are among the lowest of all Medicare supplement plans. I have a video on the high-deductible plan linked up here, and you should watch that next. But even with small price increases, they still have the same care. So the complaint is financial. The care was never denied. Here's a question I get asked all the time. Matthew, if Medigap buyers have so few regrets, why does anyone choose an Advantage plan? The real answer? Remember, people who do their due diligence overwhelmingly prefer a Medicare supplement plan. Most people don't know what they're choosing. And there's a financial incentive in this industry that most agents will never tell you about. The financial incentive gives outside rewards to the insurance companies and the agents for encouraging Medicare Advantage plans. And that financial incentive brings us to the final topic that I promised, the future of Medicare. This is both good news and bad news that you should be aware of. Let's start with Medicare Advantage plans. When Medicare Advantage plans were conceived, the insurance companies convinced Congress that they could provide all the benefits of original Medicare at a maximum out-of-pocket and still provide the taxpayer with savings of about 10% a year. And Medicare Advantage plans are supposed to be paid a monthly fee equal to what it would cost Medicare for that person, that total being $13,000 to $16,000 per year. However, the reality is that Medicare Advantage plans cost the taxpayer more than original Medicare. Some estimates are at 20% more. And even more through, we call it abusive coding, many Advantage plans have fraudulently increased their payments from the government. So you can see this video on Medicare Records Under Attack, the fraud scheme revealed, for details on what many insurance companies have been alleged to have done. They end up paying, oftentimes paying a fine prior to admitting guilt. The bottom line is that Medicare Advantage plans are costing the taxpayer 20% more than original Medicare, and this will come to an end. The government's cracking down on the fraud and has a goal to reduce the payments back down to the same cost as original Medicare. As this unfolds, Medicare Advantage plans will no longer be able to afford all these extra benefits. We'll see over time those extra benefits reduced and the maximum out-of-pocket on these plans increase. Expect the Medicare Advantage maximum out-of-pocket risk to at least triple, possibly go by 400% over the next 20 years. Medicare Advantage plan benefits are expected to decrease on average in the years ahead. So what about Medicare supplement plans? Medicare supplement plans have a structural problem and are in an increasing price spiral that is not easily fixable. I discussed the structural issue in my video, The Truth About Huge Medicare Plan Hikes. Please watch that video for details on this subject. You can expect Medicare supplement plan premiums to continue to increase in the years ahead. Many companies will start bundling their benefits like dental insurance, cancer protection, and so on to try to differentiate themselves from their competitors. They can't keep selling identical products. That just commoditizes it, and then it's a pricing war to see who loses the least. They need to do is, like the innovative Plan G that we offer, innovate, come up with a benefit package unlike the competition. My advice to you is simple. You buy today the insurance that you want to have when you are sick or injured and that will fit your budget over time. That way, if you ever get stuck in a plan, at least you're stuck with the plan that is right for you. If you must downsize for financial reasons, remember you can always move from a Medicare supplement to a Medicare Advantage plan because there are no underwriting limitations for Medicare Advantage. But in most states, you cannot move from a Medicare Advantage to a Medicare supplement without underwriting, and you have to be relatively healthy. If you're not sure with which path fits your situation, comment below. Tell me your situation. How old are you? Are you still working? Do you have employer coverage? I read these comments and it helps me to make more videos that are actually answering the questions that you're asking. And if this video gave you clarity, please hit the subscribe button and the bell icon for notice on the future videos, because this is what we do here. We make sure you understand your Medicare options before you make a decision that you cannot easily undo. I'm Matthew Clausen with MedigapSeminars.org, and I'll see you